Welcome to the channel. I am Dr. Emily-Hartwell. Today we uncover the silent warning signs of dementia specifically affecting women. Dementia is often misunderstood as simple forgetfulness, but it actually involves subtle behavioral and cognitive shifts that are frequently overlooked. Statistics show a startling reality where women are significantly more likely to develop dementia than men due to distinct biological factors. The primary culprit is the dramatic loss of estrogen during menopause, a hormone that previously acted as a neuroprotective shield. Women's brains are wired differently, with more connections between hemispheres, which, ironically, allows the disease to spread faster once started. Furthermore, the immune cells in women's brains, called microglia, become more aggressive with age, causing inflammation that accelerates cognitive decline. Understanding these biological risks is crucial. Now, let us examine the 12 early warning signs, starting with number 12. Sign number 12 is the loss of the social filter. This manifests as unexpected rudeness or making inappropriate comments in public. This happens because the prefrontal cortex, the part of the brain that governs social norms and judgment, begins to shrink. The individual is often unaware they have been offensive, as the brain mechanism that checks behavior before acting is broken. Sign number 11 involves financial confusion. Struggling to calculate a tip or balance a checkbook is often an early indicator. Abstract thinking required for math is compromised early. If a loved one suddenly falls behind on bills, pay close attention. Sign number 10 is what I call kitchen chaos. This is the loss of the ability to execute multi-step tasks. Cooking requires executive function to sequence events. Losing this skill, especially for a lifelong cook, is a major red flag. It is not just about burning food. It is finding items in bizarre places, like placing the remote in the fridge. Sign number 9 is the sarcasm gap. This is a difficulty in understanding jokes, sarcasm, or metaphorical language in conversation. The brain loses the ability to interpret tone and nuance, causing the person to take every single statement literally and mechanically. If you say, "break a leg" to wish luck, they might become alarmed, thinking you actually want them to get injured. Sign number 8 is visual spatial distortion. This is not an eyesight problem, but a brain processing error regarding depth perception. They may stop at a change in floor color, perceiving it as a whole, or struggle to judge distance when driving. This sign often leads to falls and accidents, which are frequently blamed on clumsiness rather than the underlying neurological condition. Sign number 7 is withdrawal from hobbies. This is a profound apathy where past passions no longer bring any joy. Unlike depression, where one feels sad, this is a lack of motivation caused by the brain's reward system disconnecting. Family members often mistake this for laziness or aging, but it is a critical sign of cognitive decline in women. Sign number 6 is repetitive behaviors and hoarding. You might find a drawer stuffed with identical items or expired coupons. The brain gets stuck in a loop. They may ask the same question repeatedly within minutes, forgetting they just asked. This obsessive repetition is an attempt by the brain to find comfort and control in a world becoming increasingly confusing. Sign number 5 is sleep disturbances and sundowning. The internal body clock breaks, causing confusion between day and night cycles. Symptoms often worsen in the late afternoon, a phenomenon known as sundowning, leading to increased anxiety, pacing, and confusion. Poor sleep prevents the brain from clearing out toxins like beta amyloid, creating a vicious cycle that accelerates the disease progression. Sign number 4 is confusion with time and place. Getting lost on a familiar route home is a terrifying experience. They may lose track of dates, seasons, or the passage of time, sometimes thinking they are living in the past. This temporal disorientation disconnects them from reality, making it difficult to understand events that are not happening right here, right now. Sign number 3 is difficulty finding words, known as aphasia. They might describe an object because they cannot recall its name. For example, calling a watch a hand clock or struggling to follow a fast-paced conversation are clear indicators of trouble. This often leads to social isolation, as the person feels embarrassed by their inability to communicate their thoughts effectively and quickly. Sign number 2 is misplacing items and losing the ability to retrace steps. Everyone loses keys, but this is different. A healthy brain can mentally rewind the day to find a lost item. A dementia brain cannot retrace that path. This often leads to paranoia and accusations of theft against family members, creating significant emotional distress in the home environment. And now, the number 1 sign, which is often the most surprising physical marker, a significant change in walking speed. Research shows that a slow gait is a powerful predictor of cognitive decline, appearing years before memory loss becomes obvious. The most critical test is the walk and talk. If someone must stop walking to answer a question, take note. Walking requires complex brain coordination. When cognitive resources are depleted, the brain cannot handle moving and thinking at the same time. Changes include a shuffling walk, shorter steps, or a fear of falling. This is a direct reflection of brain health. These 12 signs are not just quirks of aging. They are the brain crying out for help and attention immediately. Early diagnosis is absolutely vital. It is the key to managing symptoms and slowing the progression of neurodegenerative diseases. Many symptoms are often confused with depression or natural aging. Proper testing can rule out reversible causes like vitamin deficiencies. Lifestyle changes can make a difference. A diet rich in omega-3s and antioxidants supports brain structure and resilience against decay. Regular physical exercise increases blood flow to the hippocampus, the memory center, effectively helping to grow new neural connections. Prioritizing deep sleep is non-negotiable. It is the only time your brain can wash away the toxic proteins causing damage. Cognitive engagement, like learning a new language or skill, builds a cognitive reserve that delays the onset of symptoms. Social connection is medicine. Isolation accelerates dementia, while meaningful relationships stimulate the brain and provide necessary emotional support. If you recognize these signs in yourself or a loved one, do not panic, but do not ignore them either. Consult a neurologist immediately. Knowledge is power, and early action gives you the best chance at maintaining quality of life. Thank you for watching Dr. Emily-Hartwell. Subscribe for more medical insights and take care of your precious brain health. Remember that your brain health is a lifelong journey. Small steps taken today can protect your memories for tomorrow. Stay curious and stay active. Your mind is your greatest asset, and it deserves your daily attention and care. Practicing gratitude and reducing stress levels can significantly lower cortisol, a hormone that is toxic to the brain's memory centers. Even mild dehydration can cause cognitive fog. Ensure you are drinking enough water daily to keep your brain optimized. I am Dr. Emily, wishing you health and clarity. See you in the next video where we explore more mysteries. Let us dive deeper into nutrition. Berries contain flavonoids, which represent a powerful tool to delay brain aging effectively. While genetics play a role, epigenetics shows us that our lifestyle choices can actually turn certain risk genes off. Meditation has been proven to increase the thickness of the prefrontal cortex, the exact area that dementia often attacks. Music therapy is incredible. It activates almost every part of the brain simultaneously, waking up dormant neural pathways instantly. Protect your hearing. Untreated hearing loss is a major risk factor because it deprives the brain of essential stimulation. Monitor your blood pressure. High blood pressure damages tiny blood vessels in the brain, leading to vascular dementia over time. Alzheimer's is sometimes called type 3 diabetes. Regulating your insulin levels is critical for maintaining long-term cognitive function. Driving requires quick processing. If you notice hesitation or confusion at intersections, it is time for a professional evaluation. Time in nature reduces mental fatigue. The brain restores its attention capabilities when exposed to natural, green environments. Volunteering gives a sense of purpose. Purpose is linked to longevity and better brain health in numerous scientific studies. Read complex books. Challenge your brain with new ideas and narratives rather than passively scrolling through social media feeds. Writing by hand engages the brain differently than typing. It improves memory retention and stimulates neural activity more effectively. Laughter lowers stress hormones. A good sense of humor is actually a sign of high cognitive functioning and flexibility. Caring for a pet provides routine and companionship. The emotional bond with animals can be incredibly protective for the brain. Morning sunlight regulates your circadian rhythm. Vitamin D from the sun is also crucial for preventing cognitive decline. Oral health is brain health. Bacteria from gum disease can travel to the brain and have been found in Alzheimer's patients. Protect your head from injury. Even mild concussions can accumulate damage over time, increase the risk of future dementia. If you smoke, stop now. Smoking restricts blood flow to the brain and significantly increases the risk of vascular dementia. Limit alcohol consumption. Excessive alcohol is a neurotoxin that shrinks brain volume and impairs communication between your brain cells. What is good for the heart is good for the brain. Keep your cardiovascular system strong to ensure oxygen delivery. Manage your cholesterol levels. Plaque buildup in arteries restricts the essential blood flow your brain needs to function correctly. Check your vitamin B12 levels. Deficiency in this vitamin can mimic dementia symptoms and is often completely reversible with treatment. Thyroid imbalances can cause brain fog and memory issues. Ensure your thyroid function is optimal through regular blood tests. Indoor air quality matters. Pollutants and mold can cause inflammation in the body that eventually affects the brain's performance. Engage in creative arts. Creativity forces the brain to make new connections and solve problems in nonlinear, novel ways. Dancing is one of the best activities. It combines physical movement, musical rhythm, and social interaction all at once. Travel to new places. Navigating unfamiliar environments is a fantastic workout for your brain's spatial and memory centers. Strategy games like chess or bridge require planning ahead. This strengthens the executive function of the frontal lobes. We have covered a lot today. From walking speed to social filters, these signs are your roadmap to early detection. Thank you for trusting Dr. Emily-Hartwell with your health education. Please share this video to help save a mind.